So here we'll be starting about exercise prescription using lever system. I again thank each and everyone who just waited almost like 45 minutes for me. I thank you very much. Let us go into the session now. So before going into detail of lever system, exercise prescription, very big words, right? So let me just comprehend with very small words, starting with what force is. So here it is about parallel force system. What is a force? Whenever you try to pull your friend or push your friend or you are trying to throw something, everything is related with force. I generally keep using this word like whatever is happening in human body or outside the human body, entirely it's physics. Most of my friends will be like, how can physics is related to human body? Let us just check on this particular aspect. Here I have used a system, parallel force system. So parallel force system here is nothing but just imagine you want to open a water bottle or open a water tap. Okay, this is the edge of the water tap. Now the fulcrum is in the between. Here you will use two forces, one with the index finger, one with the thumb, and try to rotate. So whatever rotational force that is coming, whatever the tap is opening, when two forces are applied parallelly to each other, that is nothing but torque. So this torque is nothing but rotation. Whenever I move my head, like nodding, whenever I shrug my shoulders, whenever I say bye or hi, all these movements are happening in rotatory direction. That means in my body, parallel force system is there. Now, here in the image, you can see F1, F2, F3, F4, and a red line. So, red line is kind of danger here, nothing but resistance. So, all other forces can be considered as effort force. Apart from that, I'm not going to talk more physics on this right now. So, let us keep my physics bit aside and let's come to this particular force system. Here, I have used a formula torque is equals to magnitude into distance. Magnitude here is nothing but force with how much capacity I am able to do some activities, magnitude. And distance is nothing but, for example, if I consider this F1 as fulcrum, the distance between F1 and F2 is x2, nothing but distance. This distance, in very posh word or posh language, I'll be telling it is momentum. So the words torque, momentum, force will be used more in this particular session. Let us go further. I hope like parallel force system is bit clear till here. And whenever we talk about parallel force system, there is other word called lever system. So lever is nothing but a rigid segment. If I take a stick, if I take a pen, that will be considered as lever. So in lever, here for example, I am using my hand to show lever. This is my hand. If I have to remove this hand, take to my head and try to adjust my hair, my lever is going in a rotatory fashion. For example, my shoulder is a lever, a rigid bar. If I consider the collarbone and if I try to shrug, my lever is moving or rotating around the fulcrum. This is about lever. So, whenever lever is there, there are two forces. Whenever lever is there, there are two forces, two opposing forces. So one force in favor of lever, one force against the lever. So let me relate this example with a movie. In movie, you will be having a hero and a villain, a positive character and a negative character. For example, this is pen. I want the positive character or the positive force here wants this pen to be this. That means my force here should come from up. But the negative character here wants my force or I mean my lever to just fall down or just to stay in the place, no, but not to do the movement. So whatever force is helping in creating the torque, whatever force is helping in creating the torque, that is nothing but effort force. Whatever torque that is stopping the movement or slowing down the movement is nothing but resistance torque. This is about lever. So here lever system, is just one point of view which we'll be using to assess relative torques of both internal and external force. So I just gave a statement that physics is present inside the body and even outside the body, and if it is present inside the body, there is a subject which will be talking much about it, biomechanics. So nothing, mechanics of human body is nothing but biomechanics. So all the forces I talk which act internally is nothing but internal force. Forces coming from outside will be external force. So if your friend is pushing, that is external force. But if you are trying to do something like if you are trying to walk, your muscles are acting, that is internal force. If you are self motivating yourself without using any particular person, any YouTube videos or any Instagram, just motivating yourself from internal conflict, whatever you're coming, that will be your internal force. If someone else words are trying to depress you, that is external force. So when I'm sitting like this, or when you people are sitting, it's just not about one particular force that is acting. Internal and external forces. Here, gravity is one of the main thing that acts more. So gravity is like, you do whatever you want, I'll just never leave you. Gravity is very loyal to us apart from anyone in the whole world. Gravity is only loyal to you. So whenever you sit, gravity will be like, chalo, I'll be acting now, I'll start my work and all. This is slight introduction about lever systems and class of levers. Now coming to what exactly lever system is. The this thing I have already told about is the force that is producing resultant torque is effort force. So whatever effort force is created, that effort force is called as work. If I want to get my work done, I have to give effort force. If my I'll not exactly say my enemies or someone, if my friend or anyone wants me to stop to do that particular work, then they'll resist. That resist is nothing but load. So, if I want to do one activity, if I want to get my work done, I need a force that is called as effort force. But if someone is stopping me, that is load, nothing but resistance force. This is about two main terms, effort force and resistance force. Now, coming to the next thing, like once lever system is done, here I just talked about movement arm. Movement arm is nothing but effort arm and resistance arm. I just talked about lever. I just talked about lever. If this is your fulcrum, this is effort force. I'm trying to give some force here. The distance between fulcrum and the effort is effort arm. The distance is nothing but movement arm. As it is towards the effort force, I call it as effort arm. As it is towards the resistance force, I call it as resistance arm. This is about what are the terminology we'll be using in lever. Now coming to the first class of levers. So if you see this image, you can just remember seesaw. So basically, first class lever, best example will be seesaw itself. So seesaw here is nothing but I'm using effort force. For example, this guy is effort force. The other guy will be resistance force. And the triangle over here will be fulcrum. That means in first class levers, fulcrum is present between both effort force and resistance force. Opening the tap is the perfect example of first class lever. And secondary, even seesaw is first class lever. So as I was assistant professor, I can kind of relate first class levers to the students who try to butter too much with the faculty. Don't take it in negative sense. It's kind of like, just imagine, you were friends most of the time. There'll be a batch, hardly 2 to 3 students in the entire batch. They somehow will be the secret spy of the faculty by buttering them. So that category of students, I can relate that with first class levers. Why I am using this particular terminology here, we'll talk about it later whenever I come back to mechanical advantage. For time being, remember, this is fulcrum, effort force, resistance force. So we just talked about the distance between fulcrum and resistance forces, resistance arm. Here, from the fulcrum till the effort force is effort arm. This is the example which we see outside the body. Now what inside the body? So whenever a teacher comes and tell, or whenever you want to say yes, you just do this nodding movement. This nodding movement is nothing but first class lever example. Here in the image you can see atlantoaxial joint is fulcrum. Here it is fulcrum. The suboccipitals give the effort, and this is nothing but load or resistance. So most of the patients will try to, will come to you with a complaint that, ma'am, my neck is aching too much. So whenever they try to use this clause, my neck is aching too much. If they are working too much, definitely their neck will be paining. And the second most important factor here is phone. Whenever you use any mobile phone, or even if you're having a very good habit of reading novels and all, your neck will almost be in this particular fashion, in this particular movement. Your neck will be like this. So from this position, if your neck is going like this, then you are using more load. Your suboccipitals are using more load. The load is increasing. Effort should act more. So here I just told effort is kind of a positive character, resistance is kind of a negative character. Until now, is there any history that negative character won? No. By hook or crook, effort should only win. How it can win when I'm telling first class lever is present here? I have not given any other example for first class levers. So here I expect everyone, like, it is clear till here that fulcrum is atlantoaxial joint, effort is the suboccipitals, and load is the resistance. So whenever you nod, just try to palpate your suboccipitals. Are they acting or not? Can you feel their palpation? I mean, the action that is created by the suboccipitals or not? So whenever you try to do this, automatically the load and effort is balanced on the atlantoaxial joint. Here, this is best example of saying our human body tries to favor us too much by doing too many activities without us even noticing it. Now, coming to the second class of levers. This is here in the image, you can see the fulcrum is in the start, load is nothing but the resistance, and effort is at the end. So, what can you remember seeing this? When I was a kid, there was for every colony, or for every lane, there was this pump, water pump kind of thing. That pump is perfect example of second class lever. And here I have kept an image of nutcracker also. So point of application of resistance force is between fulcrum and point of application of effort force. This is your fulcrum, this is your effort. So load is present over this particular area. Okay, so this is about second class levers. Now, this is the example which we talk, or which we see outside the body. If you people can even think about any other examples outside the body for second class lever, then definitely please comment down. Now, coming to the next example in the body, second class lever, I have took the classic examples here. Let us, I'm having a specific reason for it. I'll be telling about it later. In this example, you can see this particular limb is present on the toes. So what was the image here? My load should be very much close to the fulcrum. Yes. So this is the fulcrum over here. MTP joint is the fulcrum over here. Calf muscles are the effort. And again, here comes the loyal gravity that is acting as resistance along with the body weight. So if you see, the action line of the gravity is very much clear to the fulcrum, whereas effort is not clear, or I mean, if effort is not closer. Effort has been moved away for me to raise this particular part. uh, if you ask me about levers, second class levers have got one advantage. We'll again talk about it. Just give me time till I complete the classification of levers. Now, coming to the third class. Here in third class of levers, you can see this person, this small emoji is trying to lift the entire load which is there. This is an example of third class levers. Here, fulcrum is present, effort is in between. Point of application of effort force is in between fulcrum and point of application of resistance. This is load, this is fulcrum. So, effort is present in between these two. And so, this particular lever is kind of very risky because I need to use more amount of force. Imagine you standing in between in this person's place and trying to lift the entire load. If you're trying to lift the entire load at this particular person's place, automatically your muscles should be able to take the load of this particular part. Again, it's outside body example only. Here also you can see the trolley this person is carrying. Effort is the muscle force here. Load is this particular boxes that has been added, and the fulcrum is the wheel here. So whenever I try to push, load is more, my effort arm is very much less than than the resistance arm. This is example of third class lever. So again in the body, here you can see elbow, biceps, and the load. Here, when I was reading biomechanics when I was in second year, I got one very serious doubt here. I am till here till this point in the textbook, it has been mentioned that force is present. I mean, the effort is present after the fulcrum. Yes, but biceps entire bulk is present over here. How come this comes under third class lever? Isn't it first class lever? So then I read a point which I think I should add here, that is nothing but action pull. So whenever we talk about muscle action pull, or nothing but the force the muscle is creating, each muscle is having two attachments, proximal attachment and distal attachment. So in distal attachment, more movement is created. Biceps is a two joint muscle, but whenever I have to bend my hand, I have to do this, I have to touch my face or I have to groom my hair, my biceps will be acting along with other muscles. I'm concentrating here only on biceps. Here you can see the force is generated from the entire muscle, but the action line goes whatever the insertion says, nothing but the distal attachment. Leave about the proximal attachment. Distal attachment is there. The action line will be perpendicular to the insertion line. It is not in relation with the bulk of the muscle. So if you're seeing any lever, or if you want to just try it out giving any example for one particular lever, then here you can see you need to think in relation to the insertion point, not the bulk or neither the origin point. This is about third class lever. I have written extra few points also. I'll come back to you once I just summarize the basic things what you will be learning till now. Now, here coming to mechanical advantage. Till now, levers it is fine. I would like I'd like to ask anyone if there is any doubts regarding levers, or if you feel I might be wrong at some places, comment down. Any comments? So now coming to mechanical advantage. Uh, Even if you are still in doubt of something, I'm ready to repeat it. Just tell me, just let me know. Now coming to mechanical advantage. So lever is done. How good the lever will be functioning, that is nothing but mechanical advantage. Here, as lever is fixed bar. Till now, I am telling lever is kind of fixed bar. Lever is not my particular body part. And as it is fixed bar outside the body, there is no necessity that in my body also it should be fixed bar. So, Cynthia Norkin has tried too much to simplify it. I am also trying to oversimplify it, but again, if I oversimplify it more and more, it will create more of confusion rather than clarity. Hence, I am trying to stick on the words or the examples with which you can understand this terminology much clear. Okay, so here I have used one statement: relative effectiveness of effort force in comparison with resistance force. This is nothing but mechanical advantage. What does this mean? So let us go back again to lever. Here, this comes the second class lever. If you ask mechanical advantageous lever, then second class lever stands first, because the effort arm should be very much greater than the resistance arm. So what I told, the distance from fulcrum till the force is moment arm. The distance from fulcrum till the effort arm is effort arm. The distance from fulcrum till the load is resistance arm. Here, which is greater? Effort arm is greater. In the first order lever, in this example, here, as the image is looking good, symmetrical, I have kept this. You can just shift this triangle either to the resistance side or the effort side. That means the moment arm of effort force might be greater than or less than or equal to first class levers. Now you understood why I use the example of buttering students in this particular class. They can get adapted to any kind of teacher. Only thing is they need to know where the fulcrum is. So this is basically here in first class levers, whatever the teacher might do, whatever the classmates might do, this students, it has got some advantage. So unless until they lose interest in buttering the faculty, apart from that, in this particular lever you will have one advantage. Yeah, I totally forgot to whom I can relate to second class levers. So I can relate to the students who simply listen to them to my class without asking any doubts. So I had a very good experience on this. There was a batch of students. You go and ask, did you understood? I love my students, but the response from them was always the same. They used to be the silent category of students. I'll ask them, shall I repeat the class? The same. I guess even the comments here are not coming because most of them belong to second class of levers, but it's okay. We'll try to make them third class levers. So I guess you can understand the category of students here. Second class levers are like basically the first ranker kind of students. They listen the class, silent killers, but at the end of the day, they'll be having more advantage because they'll be always in good books of the student. So I mean good looks of the faculty. Now coming to the third class levers, uh, don't take me wrong if here I'm using the examples of students. In third class levers, I would like to add backbenchers as example, because as a teacher I need to keep too much effort just to make sure they're not doing anything wrong. Not even listen, just to make sure they're not doing anything wrong, I have to keep too much of effort. This is me in this particular example, but I have got a very good advantage with third class of levers. Let us check. So I'm so sorry, I went back to examples. Now coming to the mechanical advantage. Here in mechanical advantage, I talked about the first statement, relative effectiveness of effort force in comparison with resistance force. So just imagine you want to try to open a door. So a door has got a fulcrum, a plain end, and a knob. So what is the easier way to open the door? Holding the knob and opening the door is the easiest way. If I keep my hand on the plain side or towards the fulcrum, it gets too much difficult for me to open the door. You can try it if you want. Holding the knob and opening the door is kind of easy, but holding somewhere in between the fulcrum and the effort, nothing but the fulcrum and the knob, will be kind of difficult when you try to give too much of force. This is nothing but effort arm should be always greater than resistance arm. So here you can see, if effort arm is always greater than resistance arm, mechanical advantage will be greater than 1. So as advantage, uh, I mean, as we are having mechanical advantage greater than 1, that means effort force, whatever is there, can be less. Um I'll get back to this point in a minute. Before that, just a small break from regular topic here. I would like to break one myth using this webinar. Muscle is always the effort force. this is what we were taught, or we were learnt about it, that effort force should always be muscle. I am breaking this myth saying that muscle is not always the effort force, because whenever I because in this particular statement, whenever you try to do eccentric contraction, that means active lengthening, muscle is resistance force, and the body weight, or I mean the body weight, or I mean the body weight, or whatever force that is coming from outside, the gravitational force is effort force there. So if you are trying to do any plank or any push up, your muscles are elongating. Especially in push up case, your muscles are elongating, body weight will be the resistance force there. So from now on, whenever you go and check any exercise, make sure you are not sticking on with this fact, with this myth that muscle is always the effort force. Muscle is not always the effort force. Majority of the time, muscle is effort force. Now, coming back again to the same routine, mechanical advantage. Here, mechanical advantage is equals to effort arm by resistance arm, and it should be greater than 1 for me to say that particular lever is having more advantage. So till whatever we learned now, here I have summarized it. Let us see. So in first order lever, I gave examples of buttering students where effort arm might be greater than, less than, or equal to resistance arm. That means my mechanical advantage can be greater than, less than, or equal to 1. Whereas in second order lever, effort arm is always greater than resistance arm. That means according to this formula, second order lever has got more advantage than any other levers, because here effort arm is greater than resistance arm. Not necessarily that effort force should be less than resistance force. Now, coming to the third order lever, effort arm is always less than resistance arm. That is, mechanical advantage is always less than 1. That means my third order levers are mechanically inefficient. In my body, what are present? First order levers are present, very limited. Second order levers are also less, but using exercise can be more given. Whereas third order levers are more present in my body. Whereas third order levers are more present in my body, but here only I'm saying mechanical advantage is very much less. So how I can relate these two things, how being a physio, how I can change the fact that whatever levers are present in my body are not that much inefficient. If they would have been that much inefficient, all human beings would be complaining about some pain or the other almost regularly, but that is not happening over here. So till now, you might be hearing that second order levers are mechanically advantageous levers and second order levers are very limitedly present in the body. But our body is made up of more of third order levers. How can I correlate or improve the activity using this third order lever? Because I am telling they are inefficiently present. This is about mechanical advantage which we see in levers. Now, uh, just give me a minute. If you have any doubts, please try to comment so that I can either increase or decrease my speed. There is something image that is being displayed here. Image A, image B. Yes, in image A, first let us see which image is which lever. This is the fulcrum, this is the effort force, whereas this is the resistance force. So effort force is very much near. That means effort arm is very much chotu, very much small. So this comes under lever 3, whereas this comes under lever 2. Fulcrum, effort force, resistance force. Effort arm is very much longer than resistance arm. This is what we learned till now. And I am being telling from long that effort arm should be longer, effort arm should be longer. That is nothing but creating mechanical advantage to this particular activity. Here, apart from being mechanical advantage in the sense of momentum, there is one more thing, one more term which I want you to be introduced to is angular displacement. So imagine there is some glass over here. I'm trying to take it in this particular fashion, and this is nothing but angular displacement. Okay, so our body is trying to justify it having third class levers, saying that, see, I'm not wrong. Yes, you have to use more amount of effort force, but at the same time I'll be giving more amount of angular displacement, which your so called favorite lever 2 is not giving. So the same example of door which I just told, just try to open the door using the knob. Nothing but this example. So imagine you are trying to open a door using a knob. You are opening the door and you have to walk through the entire path to open the door. But if you are holding the door somewhere between the fulcrum and the knob, this is particular door. The knob is here. This is the fulcrum. You are opening the door. There is no necessary for you to move the entire path. Just stand here, give a push. Yes, more amount of force is required, but angular displacement will be more. So second category of mechanical advantage here is nothing but angular displacement. Now I'm going to use this particular word angular displacement from now on, just to highlight my title, exercise prescription using lever system. If you want me to explain this slide again, I would request you to comment, because further I need to understand whether how can I increase or improve whatever I'm telling. I received a question: in first order lever, which muscles act as agonist and antagonist? So whenever effort is created. Oh, very good question. Before going in detail, I would like to talk about three types of contractions: concentric, eccentric, isometric. So if the lever is having equilibrium, if the lever has reached a stage of equilibrium, that means here I'm having a pen. This has reached a stage of equilibrium. That means it will not move. All the forces acting on it are kind of friends now. They'll be like, you don't fall, I don't fall. We both will be neutral. This is rotational equilibrium. This happens in isometric contraction. Please try to give resistance on this particular aspect and try to go for elbow flexion. So whenever you are going for elbow flexion, agonist will be biceps, antagonist will be triceps. But here, by doing this, you are kind of giving isometric contraction for both agonist and antagonist. Now comes concentric contraction. Let us go to lever 3 here. In lever 3, I told effort force is closer. So as effort force is closer, I need to pull my insertion point. For example, these are your forearm flexor muscles. I have to do this particular movement. So imagine my muscles over here are pulling. Believe me, I'm not actively doing anything here. My muscles here are trying to pull. So whenever they are trying to pull, this particular action is possible. That means concentric contraction of agonist is necessary. Agonist is nothing but here it is effort force in lever 3 to create the concentric contraction, so that the liver is going in this particular fashion. Now there is something called eccentric contraction, lever 2. So in lever 2, the limited kind of category levers, what I said, in lever 2, my muscles try to hold. I told muscle doesn't always act as effort force. It That means it is even acting as resistance force. So whenever you try to do eccentric contraction again, with the same example of elbow flexion, go for elbow extension giving resistance over here in this particular movement. Here the antagonist is, for example, triceps, agonist is biceps. Biceps will be going in eccentric contraction. This is about isometric contraction, eccentric contraction, and concentric contraction. So here in first class levers, here you can see almost all the effort muscles will be acting in concentric way. Concentric contraction will be compulsorily necessary for the movement to be created. Now, the flexors present over this particular area, the anterior aspect of the neck, will be resistance force along with the fulcrum. Antagonist will be the same particular muscles, anterior part of the muscles, whereas agonist will be the effort force. In most of the levers, effort forces, antagonist, resistance forces, agonist. I'm so sorry. In most of the levers, effort force is nothing but agonist, resistance force is antagonist. But except in second class lever, because second class levers, in those particular levers I need to hold the particular area by giving eccentric contraction. Except in second class levers, you can just imagine almost in every class of levers where effort arm is less than resistance arm, all movements are happening in concentric contraction. If effort arm is greater than resistance arm, that means second class levers, or in first class levers where the fulcrum is present away from the effort arm, not in the mid between. Apart from these two scenarios, all the muscles in third class lever or in first class levers will be going into concentric contractions. Basic thing only, agonist, the contraction that is happening, antagonist is nothing but the opposite group of muscle. Thank you for the question. Let us proceed to the next part. No questions. Yeah. Uh, so here I am talking about trade-offs of mechanical advantage. So I have mentioned a point over here. Majority of the muscle when contracting both concentrically and where the distal lever is free, work is done over shorter distance than resistance force. Let us come back to this. Before that, I have left one point over here telling I'll be back. Yes. So one trade-off of mechanical advantage I already explained to you people regarding the angular displacement. So whenever from now on we will be talking about lever, I'll be talking in the sense of force used. Force is nothing but if effort arm is more, that means effort force can be but not necessarily less. One point I would like to add here is, if lever system is this confusing, again how my muscles are able to take the load, what is the reason behind it? By hook or crook, for me to get up, walk, sit, come, talk, and all, whatever daily activities we keep on doing in this particular aspect, here I would like to tell one thing is my body is always in the game of winning only. My muscles should always be in the game of winning talk only. If it is losing, I'm having some misbalance. Imagine this is a pole. You are trying to pull, I am trying to pull. You are much stronger than me. What happens? The pole tries, the pole falls towards you. This is basic thing which we know. The same thing happens in the body. I am just telling that lever is nothing but a rigid bar that is present. Agonist is present, antagonist is present. This is agonist, Antagonist. So whenever I'm trying to tell this is agonist and this is antagonist, my muscles, if my antagonists are very much tight, my posterior muscles are too much tight, they go into increased cervical lordosis. That means there will be some kind of mechanical disadvantage or some kind of postural issues or muscle imbalances, because I'm trying, my muscles are trying too much hard to maintain the equilibrium. So whenever you are standing doing nothing, no activity, your muscles are still acting just to make you do one particular posture, either sitting, standing. Even when you are sleeping also, your muscles are having some tone in it, so that tone should be maintained. You will be seeing many people with too much of postural changes, muscle imbalances and all. That is happening because there the new net rotational equilibrium has been stopped. The net rotational equilibrium between the effort force, resistance force has been delayed or stopped, because of which this has been uh, becoming an issue. My body, as I already told, it's always like, today I have to get up and win the task of living. So whenever it is having that particular thing, all my levers get activated, and whatever contraction they want and whatever lever they want to go, they'll definitely go in that particular fashion. There is no necessity that when I stand, I should be acting in one first order lever or second order lever or third class lever itself. When I'm telling exercise the particular patient, I'll be like, okay, this thing is not working for this case, let me modify the exercise, changing the lever system. This is the third important thing which I would like to add. So first is the distance between the fulcrum and the effort force, nothing but the movement arm of the effort force. Second is nothing but the angular displacement. Third comes for third comes the speed. So these three important things should be kept in mind. I'm repeating it: speed, force, and even the angular displacement. These three things I need to make sure whenever I'm trying to prescribe any particular exercise for any particular case. Now we have completed the levers, we have completed the trade-offs. I would like to rephrase one sentence here. Levers with mechanical advantage, effort force can be smaller or less. This is wrong statement. I would like to rephrase it saying that even though the moment arm is greater than or less than the effort force or resistance force, whatever it may be. That means EA greater than RA or RA greater than EA. EF should always win. That means my effort force should always win. Effort force should always be more than resistance force just to make the activity done. This is the main scenario which we need to remember when we talk about lever system. Apart from how the effort arm is long or how the effort arm is small, let us forget that the mechanical advantage is based on effort arm. I have told one sentence that it can be smaller or less, whatever it is there, that necessarily doesn't mean it should be smaller than resistance force. Whatever it may be, I should have the capability to avoid all the odds and come and sit. That is nothing but, by hook or crook, my effort force should be very much more than the resistance force. I'm repeating it again. Rephrase the statement that says levers with mechanical advantage, where effort arm is greater than resistance arm, into effort force should be greater than resistance force, irrespective of EA greater than RA. This is the second important thing you can try to remember when you are talking about exercise prescription. Once I told that uh, effort force should be always greater than resistance force. So effort force is always kind of positive, I told. So effort force, when it is kind of positive, I need to go for concentric contraction. Here I have written a word: majority of muscle when contracting concentrically and distal lever is free, work is done over shorter distance. Imagine two kind of exercises: closed kinematic chain exercises, open kinematic chain exercise. So I hope you can see my hand over here. This is kind of open kinematic chain exercise. If I go and start doing push up, that will be closed kinematic chain exercise. So in both the cases, resistance will be there. In open kinematic chain, or in closed kinematic chain, again my gravity will not leave me. But here in open kinematic chain, I can fix the resistance. In open kinematic chain, I can fix the resistance, whereas in closed kinematic chain exercise, resistance keeps on varying, but angular displacement will be less in closed kinematic chain exercises. Hence, most of the muscles, whenever they are contracting concentrically in this particular example, work is done. Just see at my fulcrum. Don't concentrate on this particular part. This is the work done. Here you can see the distance covered at the fulcrum is very less, but the distance over here is more. The arc created here is more. This is happening because of angular displacement. Whenever my muscle contracts concentrically, I can think of lever 3 directly. Now coming to the second part of webinar, exercise prescription. So I don't know how many of you might have joined physiotherapy just thinking, just by chance, as you might not get selected in any other stream, hence you joined here. I don't know how many of you might have joined, but one thing is, we can prescribe exercises to an extent where the other professionals can't even think about. I'm telling this particular statement with too much of confidence because in my practice, I have seen using exercises, same exercises, modifying a bit, how much different change that can create in particular patient. So most of the times, you will have, for example, let me take a condition of cervical spondylosis. So almost everyone is having some kind of neck pain. I And imagine I am some 60 years old. So there are three different category of patients with 60-year-old, same complaints. Cervical spondylosis is the condition. So patient A, patient B, patient C, almost all symptoms are same. And yeah, MRI has been revealed that more or less same kind of disc bulges are there. Will my exercise be same for all the three? No. Depending on the patient's MMT, muscle strength, his power and endurance, I'll be changing the exercises accordingly. Maybe in case one, I'll be using more of lever 2 exercises, whereas in other case, I'll be using more of lever 3 exercises, because according to me, my assessment showed that patient 3 or patient C can do the activity with much force when compared to patient 2 or patient 1. Hence, tailoring exercises to optimize muscle engagement and joint stability while minimizing injury risk. Only thing I would like to mention again and again is, if the patient is coming to you, it's okay if you're not able to reduce his complaints or pain. Don't just add up one more complaint to his complaint list and send. Irrespective of whatever you are doing, just try to relieve one or the other complaint at least. Just don't add up to his mess. This thing, tailoring exercises where you can engage the muscle activity, muscle recruitment, so that joint is at stability, where injury risk has been reduced. This is about exercise prescription, first important point. Second, it is kind of art, and no one will ask you if you are having perfect example or perfect description for whatever exercise you are giving. Now, coming to goals while prescribing the exercise. So here I am talking about the goals which I used in levers. Angular displacement, pain free, that nothing but force should be less. The other thing is stability. One thing I would like to add here is speed. Angular displacement is nothing but, angular displacement and speed both are not same. Angular displacement is the area covered. Speed is with how much efficiency I am able to do, whereas pain free is nothing but force should be very much less. These are the three goals I need to remember every now and then whenever I'm trying to treat a case. Here I'm not telling angular displacement, force and stability or speed should be present in all the exercises. If one exercise can give you angular displacement, good, maybe that person needs angular displacement, whereas other case might be needing force more, other case might be needing stability more. So depending on what category of patients you are having, you can increase or decrease. That means in few cases you can decrease angular displacement but increase force. You can increase stability but decrease angular displacement. You can increase speed but decrease force. Everything is under your control. Only thing is you need to know how to apply. So now, uh, a small comeback here. I have added a slide that is related to exercise therapy. So before me discussing about the principles of training, let me talk about the three types of exercises which we give: strength training, power training, endurance training. So here power is nothing but the force with which you are able to complete the task. The participants who were staying, who just opened the link whenever the link was sent, the people who filled the forms and who are ready to join my webinar, they have too much of guts, nothing but power. You don't know, even you don't know how I teach and all, but you showed some amount of force so that your work should be get done. Okay, I'll learn something or I'll try to find out the mistake something. So with whatever intention you joined, you showed some power to come. Power is nothing but force to complete this particular activity. Second is strength. So everyone knew just now, whenever you joined, there was some technical glitch and it got delayed for more than 45 minutes. So this 45 minutes before that, whenever you joined the webinar, you were like, chalo, Varsha ma'am is going to talk about so and so, we'll try to listen. Even if you're trying to listen, the muscles that hold your neck or the attitude you showed to just listen, that is strength. And you are bearing me since 6 o'clock, almost 1 hour 40 minutes. This is nothing but your endurance. So strength, power, and endurance. Endurance is the capacity of you till how much level you can do the activity, how much time you can do the activity. Strength is work, getting your work done. Your aim was to just make the attend the webinar, either 5 minutes, 15 minutes, half an hour, whatever it is there. Just to attend the webinar was your strength. Joining was your power. Staying till this long is your endurance. So these three are the main important things when we join for training, any type of training. If any patient is coming to you, you checked, you assessed him, you felt strength is less but power is more, so you'll be concentrating on strength training. Same with endurance. Most of the patients will be like, ma'am, I'm able to do this particular activity, but after some time I feel I am kind of strained, I'm kind of tired very easily, I don't want to get tired this easily. That means the patient is lacking endurance. This is about three types of training which we use. Now coming to principles of training: overload principle, set principle, reversibility principle. So overload principle is nothing but increasing the resistance depending on the time and strength of the particular patient. For example, there is a client, you started teaching him bicep strengthening. After some time you feel like 5 kg is very less, you need to increase the load at that particular time. If you are not increasing the load, the strength just stays, strength will not increase, strength will just stay. Now coming to second principle, said principle, specificity principle. So here you can relate the specificities principle with two examples. If any patient is coming to you and he says, I want to increase my efficiency of work, he is using some open-ended kind of question or statement where he wants to increase his efficiency. That increase in efficiency can be increase in endurance, increase in strength, increase in power. You, after checking, if you feel like his strength is less, stick on strength training first. Be specific to your goal. Same thing, if your goal was somewhere with these three: angular displacement or pain free or stability, your goal should be specific. Whenever you are giving word to patient, we are not some magicians. Today the patient is coming, within 10 days he is ready for IC and bodybuilding or not. No, that doesn't happen within 10 days. If any patient is coming with saying, I just want to increase my core strength, stability and all, seeing Google, uh, using words of such kind, you stick to the particular thing that it requires some amount of time. You are not magicians that pain can be reduced, the muscle efficiency can be improved within a span of 1 week or 10 days. Now coming to the third principle, reversibility principle. Reversibility principle is nothing but your work will be recognized till you hard work. After you stop doing hard work, automatically whatever you have done will be falling down. This is nothing but reversibility principle. There might be many people who might be using who might have used this COVID time very much. One year of break where you might be concentrating on one particular habit, but after COVID, most of them again getting back to their busy schedules and all. What happened, for example, if I talk about exercise, after doing for 30 days, whatever changes I have seen in me, if I stop even for 5 to 7 days also, my muscle will try to show a slope here. Nothing but the efficiency can be reduced because I'm not doing anything to maintain it. That is reversibility principle. Now, my title here is exercise prescription using lever system. So here I would like to add one thing. What category of patients will be seeing? So, one advantage we physios got is, irrespective of you doing whatever specialization you want, BPT, 4.5 years of BPT, and in MPT you will be doing cardio, neuro, sports, ortho, and whatever other specializations are there. If me being a sports physio, if any ortho case is coming, I can try to cover it. I can try to treat that particular thing. This is what advantage we physios got. Irrespective of whatever the category the patient belong, I can complete the entire thing, because I have been taught by my faculty all these things where I can use the same things in other streams also. Even in MPT also will be, the entire first year will be generalized, where there is no specificity over there. Hence we have got this advantage. Here, in clinics, most of the times you will be happening to see three sorts of people. One, mediocre sedentary lifestyle, I can tell. Most best example will be IT professionals. The other category of patients will be gym going people, or athletes. And below category will be bedridden cases. So three category of people I have got. First, bedridden. Second, IT professionals. And third, athletes. So in first patient, I need the patient to exert some force first. That means I need to give lever 2 first. Without giving lever 2 exercises first, I can't go to lever 1 or lever 3, because in both lever 1 and lever 3, effort arm is less compared to lever 2. Hence, in any case of bedridden patients where you see the muscle strength is less than 3, go and teach them lever 2 exercises, because there your target is increasing force. And stick on to the principle of specificity. Where your target is increasing force, force can be increased. I mean, more force is not needed when you use lever 2 kind of exercises. So let's go for lever 2 kind of exercises. Here, for better understanding, I have used only one muscle, hamstrings. So lever 2, here you can see which exercise it is. Hip thrust. So here you can see a lady is using a barbell. Hamstrings is there, hip is also there. So she tries to thrust her hip up. This is lever 2 exercise. I'm telling how it is lever 2 exercise. Here you can see the barbell comes resistance. Hamstrings is effort. Hip is here. Now you can ask me, Madam, in lever 3 example, you told that muscle bulk is not counted. The insertion or the origin point is counted. And if I take the insertion over here, insertion is getting more far away. That means effort arm is more. Yes, here you can see the fulcrum is present. Here, resistance arm is very much less and effort arm is more. That means with very little amount of force, I can make the particular movement possible. This is about lever 2. So any bedridden, I'm not saying get the bedridden patient and make him do hip thrust. No, this is example which I'm giving for hamstrings. If you want to talk about other examples of lever 2 which you want to incorporate, you can please comment down in the comment box. But here I'm taking example of only hamstrings and trying to correlate in all three levers. So here hamstrings in this particular example in hip thrust is nothing but lever 2, where fulcrum is between, effort arm is more, effort arm is at the insertion point. So from here this particular point will be effort arm, where the effort force will be acting. This is the resistance, fulcrum is here. So resistance is very much less compared to effort arm. Hence, with small amount of force, I can create more amount of activity. If this is clear, I would like to proceed to the other lever example for hamstrings. If there are any doubts, please comment down. Comments ko chalo. So as there are no comments, I'm going to other lever. No comments. No comments. I'm going to the other lever, Nordic exercise. One of my favorite exercise to train hamstrings. So I told lever 2 is for the exercise where bedridden patients can be used. So just keep in your mind that whenever you are having bedridden patients, you need to go for lever 2. Whereas this lever 3 is nothing but Nordic hamstring exercise. I told there will be one extreme category of patient, bedridden is done. The other is athletes. Here in athletes, I told angular displacement, your target should be more of angular displacement. Because one thing in lever 3 is, even though more force is there, more force is required, the speed that is created, the angular displacement that is created is too much in lever 3. Kicking, slapping anyone, or just throwing, swinging, me taking a racket, badminton racket, trying to serve or trying to give a throw, in all the activities lever 3 will be acting. These are the activities which we'll be seeing in athletes. Most of the times these lever 3 is more. Mark my words, I'm telling most of the times, I'm not saying always. So most of the times lever 3 is present in athletes. We need to incorporate lever 3 in athletes because it will be giving more amount of speed, more amount of angular displacement. So here my target will be increasing speed and increasing angular displacement. Here you can see this will be the resistance, this will be the effort, and my knee is the fulcrum. Effort arm is less. Yes, this effort arm is less, whereas resistance arm is very much high. This particular thing where the patient is going again back to lying position, prone lying position, is lever 3 Nordic exercise, where effort arm is very much smaller than resistance arm. This is Nordic exercise in hamstrings. There might be any other exercises also. If you can correlate any other exercises in lever 3, please comment down. Once this is done, we'll go to lever 1. Hmm. Okay. Now coming to the last step of my webinar, lever 1. So I have added this image uh, telling this is lever 1. Let us see whether it is lever 1 or lever 3 or lever 2, and why I have been added this thing here. So here resistance is here, effort is here, fulcrum is here. So classic lever 1 example, yes or no. Here you can see resistance, fulcrum, and effort. So will it come under lever 1 or not? Please comment down. I am telling this is resistance, this is fulcrum, this is effort. Hence, it is lever 1. Please try to comment down if I'm wrong. No comments? I am still waiting for the comments. Till then, I would like to add one point over here. In this particular image, you can see this is my knee joint. My hamstrings go and insert on the tibia and the fibula, biceps on the fibula, uh, and tibia on the, I mean, semitendinosus, semimembranosus on the tibial medial part. So these two things, two muscles are inserting after the knee joint is getting completed. And I mentioned a point that muscle torque is whatever torque or movement arm should be created, angle of pull, it is from the insertion point. So as it is from the insertion point, that means this is fulcrum, this is effort force, and this is resistance force. I shouldn't have kept the image here, but I generally like to teach people by confusing them. Hence, I have kept the image here. Perfect example for lever 1 is kettlebell swing. So, in kettlebell swing, take a kettlebell, stand shoulder width apart, and try to use the swing kettlebell and try to swing. Hamstrings is two joint muscle, right? So, yes, here hamstring is two joint muscle. Hip joint is there, knee joint is there. Hamstrings will be crossing both hip joint and knee joint. So whenever I talk about the attachment or movement arm or whatever it is, I already told insertion point should be considered. Here in kettlebell swing, trunk flexion and extension will be more. This particular movement will be more rather than knee flexion and extension. So in kettlebell swing, what happens is, here, hamstrings proximal attachment is over this particular area. Fulcrum is here. Fulcrum is in between effort arm and the swing. Imagine this person's hand act as a kettlebell here and he is trying to swing. So whenever he is trying to do this particular movement with trunk flexion and extension, the fulcrum is being the hip joint and the hamstrings proximal attachment is being the effort, and then this gets the resistance. Here I am wrong completely using this particular image. The perfect example of lever 1 is kettlebell swing. This was about my seminar. I would like to summarize the entire seminar using just 2 to 3 sentences. uh, Exercise prescription is just not about using lever system or any particular exercise. Never follow only one exercise. Try to modify exercise depending on the patient's complaints, patient's signs, and everything. Because one thing at a time, we can concentrate, we can at least do that particular thing. And this initiation of me taking seminar on exercise prescription using lever system, there might be many people coming with too many of thoughts, like how effort arm, resistance arm, and how I can modify in my body. Yes, you can modify, and I gave an example here: hamstrings in lever 1, lever 2, and lever 3. In all the three examples, I might be wrong, I might be right. Whatever it is, this particular exercise prescription has worked for me. And there is something exercise prescription using length tension relationship also. Exercise therapy, biomechanics are not two separate subjects. We need to connect the dots between exercise therapy and biomechanics. And I thank everyone for staying this long and trying to just share my opinion on how good we can prescribe the exercises. Thank you.